That is the starting point for our conversation this morning with Dr. Isaac Bogash, who's an infectious disease specialist and a member of Ontario's COVID-19 Vaccination Distribution Task Force. He is in Toronto. Good morning, Dr. Bogash.
Good morning. Great to see you.
You too. Now, listening to Breyer's reporting there out of Vancouver on the BC announcement, again, just to be clear, up to now 4 months between first and second doses, the longest interval of any place in Canada. What's your view on extending it so far out beyond the time frame for which we have data?
Well, I think it's first important to recognize that the clinical trials tested these, as we know, for either a dosing schedule of day 1 and day 21 for Pfizer, day 1 and day 28 for Moderna. Since then, there have been multiple studies conducted in multiple countries that demonstrate that you can extend the doses. You don't have to be married to the day 21 and day 28 timeframes for the second dose. Having said that, I think the contentious issue here is to what extent can you delay that second dose? You know, what is that sweet spot between providing that second dose and can you take it too far? Certainly the 4-month mark is pretty far by Canadian standards. Internationally, we've seen the UK extend that second dose by a significant amount as well. Quebec started doing this early on. Other places are sticking pretty close to the day 21 and day 28 scheduled second doses. But I don't think anyone would argue that you can delay it. It's more of a question of how far can you delay it.
In addition to that, I mean, we're certainly hearing statements I've read in the last 24 hours from both Pfizer and from Moderna. They advise still, they're the company that makes these, that you stick to the protocol and to what is found in the clinical trials. But the top scientists, as we've talked about, Canada's top science advisor, suggesting that be the course as well. But there are other risks as well, aren't there, Dr. Bogash? Like the longer the interval, people might not be inclined to go back for that second dose. And with the variants, does that create even greater opportunities for, things to go awry?
Yeah, that's certainly a theoretical possibility. I think you have to approach this through different angles. There's, the purest medical and scientific angle that looks at the data that's available from the clinical trials and trying to adhere to those clinical trials. On the other hand, there's a public health angle where here's an opportunity where you can provide significant protection to a much larger cohort of your population in a much shorter time frame. And quite frankly, this is a public health emergency. And I think that's why many jurisdictions are starting to delay that second dose. And that's why I think you'll see the debate raging around how far can we extend that second dose, not should we extend that second dose. It's more of a how far can we extend that second dose.
I was struck by the description, though, again, from that top science advisor, that this is a population-level experiment.
I don't know if I'd call it an experiment because there truly is emerging data from multiple sources, from multiple groups that do demonstrate that it is okay to extend the second dose. I'm sitting in Ontario now. We've been doing this as well with the Pfizer and Moderna, but we haven't been extending it beyond 42 days. And so it's really stuck with that. And in fact, the second dose was delayed in many cohorts, not all, not those in long-term care, but in other cohorts, it was delayed between 35 to 42 days after the first dose. So like other places are doing this in Canada. And again, there is data to support this.
Okay.
Of course, data isn't all created equally. Some data is stronger than others and is more robust than others. But there is a growing global experience. There's a growing Canadian experience, and there's growing data sets that do suggest that it is safe to extend the second dose. 4 months is clearly on the long end of the spectrum. But again, 2 months to the 42 days is well within reason, and even that 4-month mark might be well within reason as well. Certainly, they'll be able to vaccinate their population much, much faster, and I wonder if they'll be able to get their epidemic under control much faster as well.
Real-world evidence comes into what I also like to ask you about, and this is another interesting area of discrepancy between Health Canada, Dr. Bogoch, and the National Advisory Committee on Immunization on the AstraZeneca vaccine. We're reporting on this. We were talking last Friday as the news broke. Health Canada had approved the AstraZeneca shot for everyone in Canada 18 and older. And now the recommendation from NACI, just coming out yesterday, that it's not advising it for anybody over the age of 65, so 18 to 64. Can you explain the discrepancy?
Yeah, this is another great example of having different groups look at the exact same data, and coming to different conclusions. And, quite frankly, I think that's okay as long as it's explained and as long as it's communicated in a meaningful manner so that the general public, who is clearly watching this very closely, understands. Now, if you look at the NACI document closely, they basically state, they don't say that vaccinating those over the age of 65 is not effective with the AstraZeneca vaccine. What they're saying is there's just not enough data. There wasn't enough people enrolled in that clinical study to really make a strong recommendation to include that vaccine in those over the age of 65. If you look globally, you see different groups doing different things. For example, the European Union said, we're okay with this. Over the age of 18, go for it. But individual countries, for example, Germany and France said, you know what, we're not going to give this over the age of 65. But interestingly, now there's real world data emerging, initially from Scotland, then from England, demonstrating that, in fact, this vaccine performs very well after one dose in older populations. And in fact, yesterday, France turned around and said, you know what, we're going to give this vaccine to people over the age of 65 now. So again, data moves with time, policies move with time, and change with time, and different people can look at the exact same data and come to different conclusions. Just explain it well, communicate it well, so you don't lose public trust.
Well, this is what I want to ask you about next. And thankfully, you do explain things well, and we understand a lot better as a result of our conversations. I'm glad you pointed out the France change of position, because when last we spoke about this, they were limiting it to under 65. They have changed it, and now they're allowing it again for everyone who's an adult. But the effect of unclear communication, the effect of changing message. You were talking about this in a report that we've been airing this morning from our colleague Christine Birak. What, in fact, does this do to the provinces who have to roll out the vaccine? And what does it do to Canada's seniors who, in some cases, really won't know what to do?
Yeah, exactly. I think it's got to be communicated in a very open, honest, and transparent manner. Obviously, you've got Health Canada saying it's okay, NACI saying we're going to hold off. It would be very helpful for senior public health leadership to explain exactly why the recommendations are the way they are. The other thing, too, is what if you're 63 or 64 and you're signed up to get AstraZeneca? Like, is there some magic hurdle you cross and you're now a year older and it's not going to work? Of course, you have to draw the line someplace if you're going to make those age cutoffs. And we do see age cutoffs for other vaccinations as well. For example, influenza vaccines, we certainly have age cutoffs where we give a higher dose influenza vaccine for an older population and a different influenza vaccine for a younger population. There's totally precedent for this. And again, as long as it's communicated, as long as people are very open and honest about why they made the decisions they made and how they came to those decisions, and of course, as long as those decisions evolve with time, with emerging data, then we'll be okay. Because you truly need public trust and public buy-in to have successful public health campaigns, including Canada's largest vaccine campaign in history.